Greetings from Spain. Thank you very much for watching this presentation regarding the relationship between psychological conditions and benign prostatic disorder. I have no affiliation to disclose regarding this presentation. Quality of life is defined as an individual perception of their position in life in the context of the cultural and value system in which they live in a relation to their goals, expectations, standards, and concerns. Urological condition may affect quality of life and make him vary his daily activities. We aim to find if there is a link between psychological or psychiatric conditions and benign prostatic disorder. A multicentric prospective observational study was developed, including men over 49 years of age referred to urology by their general practitioner. An exhaustive comorbidities checkup was done, and the disorders were categorized according to the urological and psychological conditions mostly affected patients' quality of life and other concomitant conditions. For analysis, we divided in those who first attended for a prostatic or for a psychological conditions. Group A, men who first attended the general practitioner for psychological conditions. Group B first had a urological condition. The mean age of the sample was 63 years old with a range between 49 and 94 years without difference between groups. All men had at least one main urological disorder, but not all did have a main psychological condition. Non-bacterial prostatitis, acute bacterial prostatitis, other urinary tract infection, PIN and prostatodynia were the urological diagnoses identified. The psychological conditions found were anxiety, depression, insomnia, psychosis, smoking habit, and alcoholism. The mean time since the diagnosis of the main psychological conditions was 93.43 months, greater in Group A. On the contrary, the mean time since the diagnosis of the main urological conditions was greater in Group B, with mean of 40.37 months for the whole sample. The mean time between the diagnosis of the main psychological and urological conditions was 72.52 months, greater in Group A. In the first graph, we can see the distribution of the main psychological conditions in both groups. When first attending the general practitioner for a psychological condition, anxiety and smoking habit were more common. However, when first attending for a urological condition, it is more common not having a psychological disorder, followed by anxiety and both smoking and alcohol abuse. In the second graph, the distribution of the secondary psychological conditions is shown. Anxiety, psychosis, and not having any psychological disorder are more common in Group B. On the contrary, depression, insomnia, smoking habit, and alcohol abuse are more common in Group A. This is the multivariate analysis. The following figure represents the factorial analysis between psychological and urological conditions in their likelihood to get cured or not cured. If we focus on the psychological conditions, those more prone to get cured are anxiety and psychosis. On the contrary, the psychological conditions less likely to get cured are depression, insomnia, and smoking habit. On the other hand, urinary tract infection and non-bacterial prostatitis are likely to both cure and not cure urological patients. PIN and urinary tract infections are more likely to get cured, and acute bacterial prostatitis is likely. Alcoholism is the main psychological condition more linked to urological conditions. Benign urological conditions can have a negative impact in men's quality of life, especially anxiety. Some authors have explored the possibility to treat chronic pain syndromes with antidepressant, although a recent concurrent systematic review found that antidepressant may be ineffective for the reduction of prostatitis symptoms in patients with chronic pelvic pain syndrome. Alcohol abuse is also frequent between patients with benign urological conditions, but also in those patients with an impaired psychological background with a tendency of not being cured in the long term. Longitudinal MRI studies of alcoholics have found that following about 1 month of abstinence from alcohol, cortical gray matter, overall brain tissue, and hippocampal tissue increase in volume. These changes may be reverted with abstinence. However, the role of anhedonia in alcohol protracted withdrawal syndrome makes it difficult to change habits or having the strength to resolve other health problems. In conclusion, psychological conditions are frequent in patients with benign prostatic condition, being alcohol abuse the most frequent in both cured and not cured patients. Thank you very much for your attention.